purpose of our fellowship program is twofold. It's to train physicians in the care of patients with Lyme and tick-borne diseases, and at the same time to create a cadre of physicians that are trained not only in excellence in clinical care, but also in clinical research. And there's a huge need for this because of the increasing number of cases. These are people that have finished their medical school, finished their residency, and now are ready for advanced training. Typically, that would be like a fellowship in gastroenterology or cardiology, but now we'll be offering this program where they can get fellowship training in Lyme disease. The fellowship program is especially important for Lyme disease because of the unique aspects of the disease. We see this training as really training the next generation of excellent physicians and physician scientists that will understand the unique aspects of Lyme disease and will be able to apply those not only to the care of patients with Lyme disease, but to the research future for better understanding, better diagnosis, better treatment of patients with Lyme disease. It's very important that this fellowship program is internal medicine based. Internal medicine is the core discipline in medicine. It's a multidisciplinary field by nature. It doesn't just focus on one organ system. It understands the interactions of organ systems. So this advanced program and fellowship will capitalize on our expertise at Johns Hopkins. Hopkins has been one of the leaders in internal medicine training literally for over a century in the United States and in the world. One of the benefits of the fellowship program being at Johns Hopkins is the access to our incredible faculty. The fellows will be working with senior mentors across disciplines, including infectious diseases, rheumatology, neurology, adolescent medicine, and the access to these mentors, both clinical mentors as well as research mentors, is really quite unique for really any institution in the United States. The rheumatology division where we're centered is the #1 rheumatology division in the United States and is really a model for how to combine excellence in clinical care with translational clinical research, understanding how to advance the epidemiology and prevention in combination with the diagnosis and treatment of these complex illnesses that are often misunderstood and really require advanced training. Fellows will have the opportunity in their second year of the fellowship training program to pursue a Master's of Public Health in the Bloomberg School of Public Health. This is a huge opportunity to be able to have a paid for master's degree sponsored during the second year of their fellowship. The second year will really focus on this research opportunity, and it will again combine the collaboration between the clinical physicians and mentors in the School of Medicine with the public health experts in the School of Public Health. We need to raise $2 million for this fellowship to both pay the fellows and to pay for their training and for the faculty expenses associated with running the program. The funding is essential to fund the tuition of the fellows in the Bloomberg School of Public Health in their second year of fellowship. This $2 million investment is really an investment in the future of Lyme disease training. It'll support the program for the first 5 years of the program and will get us off to a foundational start that'll allow us to expand and to seek other funding sources, but to get us going with our first group of fellows, really starting next year in 2022. This program is really a unique opportunity. We all know that there's a lack of specifically trained physicians that are understanding, sympathetic, but also rigorously trained in the field of Lyme disease and tick-borne infections. And this fellowship really provides a huge opportunity to create a program that will be a model for the United States as we start to train highly specialized physicians that know Lyme disease and tick-borne diseases. These trainees can then populate other training programs around the United States and can advance the field so that we can understand more about the best ways to care for our patients. This is long been waiting for a major academic medical center to become involved in this kind of training that's so desperately needed. And Hopkins is well suited and enthusiastic and excited about really launching this first fellowship program that will train the next generation of academically trained and yet compassionate physicians that understand the care of Lyme disease and tick-borne infections.